forth motion using friction. Notice that I'm not using a tourniquet right now. If you leave the tourniquet on too long, it'll blow the vein. After cleaning that for 30 seconds, this needs to dry for 1 to 2 minutes for full antiseptic properties. This is a good time to examine your IV catheter. Take it out, examine it for manufacturing defects. Notice there are no barbs, which that would be painful if there were. There is a safety device on this brand of catheter. Once I enter the vein and have it fully threaded, I'll hit that safety device and it'll retract the needle. Also notice that there's a little hub right here that I'll use my index finger to thread that IV into the vein. That is non-sterile. The sterile portions of this catheter, because I have on non-sterile gloves, and remember your principles, non-sterile to non-sterile, is going to be the IV catheter itself. So if it's accidentally brushed or contaminated or hits the table, it needs to be thrown away. And the inside portion where I'm going to connect the flush and that goes into the patient's venous system, that is also a sterile area. And that looks good. I'm going to go ahead and put it back, the lid back on it, and apply the tourniquet 6 to 8 inches above the site. How's it feel, Janet?
Feels pretty good.
Good. 2 other things you can do to ensure that you have a successful IV start is that when you're holding this hand, and it's nice on these hand veins, you can just drape them over the table and pull them back really taut. Especially with the elderly, these veins can roll and cause you to miss the vein. So you're going to use a lot of traction and pull very taut on that vein. The third thing that you can do to ensure success is watch the angle of your needle. For an IV start, your angle should be at a 10 to 30 degree angle. 10 degrees for a superficial vein such as this one, or a 30 degree angle for a deeper vein. When I hold the IV catheter, I'm going to hold it between my thumb and middle finger, and I'm going to leave this index finger free to thread the vein. So I'm going to go in, and the widest part of this vein, bevel up, straight in, just a little stick. Once I get a blood return, and there's the blood return, I'm going to lower it even with the skin, go a 1/16 of an inch further. Holding this stylet very carefully, I'm just going to push that catheter along that needle until it's completely threaded. It is a trick here too. If you move the stylet before you thread the needle, you'll take that needle out of the vein and lose it. At this point, I'm going to hold it carefully. I'm going to go ahead and pop the tourniquet. I'm going to be ready with my IV flush, careful not to contaminate the end. And then you can see the blood is backing up. As soon as I take that stylet out, blood's going to flow freely through that. To prevent that from happening and hopefully be a little less messy, what I'm going to do is completely occlude the vein to stop the blood flow. Don't push right on the IV catheter itself. It'll smash it into her arm and hurt. So I'm just going to go distal to the catheter with firm pressure so I can stop the bleeding. I'm going to go ahead and press that button and go ahead and attach this, and make sure that you get it nice and snug. I can go ahead and gently flush, and I'm going to use 2 to 5 mils of saline. Did I lose it? Make sure nothing's clamped. There it goes. Just a sticky. That one's just a little harder to push than most salines. There it goes. And you can see the saline's flushing away. You want to get all of that blood out of the hub of the catheter. And go ahead and take that off. Clamp the slide clamp. And then this is an IV securement device. This IV securement device holds this in place. It goes right over the needle. What they have found is if you place an IV securement device over your IVs, number one, they stay intact longer and they have less risk for infection. There are different types and brands of IV securement devices, so they all look a little differently. And you're just going to place it. Gives a little extra protection. And this one has all the tape on it too. I just ordered these. There we go. So you've got a little protection. Should snap right in place. And it has secured your IV. Next, you'll need to use a little sterile tape to tape and secure the loose ends. And I'm going to put one that I can tell that's moving a little bit when I touch it. Put a little piece of tape right here. And then we'll use another little piece of tape and tape it here.